Hello and welcome to my video presentation of emotionally focused therapy. My name is Corey Powers. This is for Psychology A455 Interventions for Challenging Behavior at the University of Alaska Anchorage with the very respected and great Professor Dr. Michael Machado. So what is emotionally focused therapy? Well, in the world of therapy, it's commonly referred to as just EFT. It was created in the mid-1980s by two people, Sue Johnson and Leslie Greenwood. They kind of went their separate ways, and Sue Johnson expanded emotionally focused therapy to what it has become known as today. Leslie Greenwood, on the other hand, kept going with emotion-focused therapy, which sounds the same, but is different, and it's also known as process experiential therapy. Basically, the difference between emotionally focused therapy and emotion-focused therapy is that emotion-focused therapy was created as an alternative to cognitive-based approaches, and the goal is to try to change emotion with emotion, that is, to replace a negative emotion with healthier emotions for the situation that the client may be seeking. This is done using active methods such as the Gestalt interventions. Emotionally focused therapy, on the other hand, the goal is to create change through following the emotion to help reshape the attachment bonds in relationships. There are many therapeutic components that are associated with EFT, emotion and cognitive therapy, affective neuroscience, dynamic and family systems theory, humanistic approach, evidence-based approach, but really what Sue Johnson took and combined was experiential therapy, the attachment theory, and structural theories. Dr. Sue Johnson credited these three people as the main components of her EFT. Carl Rogers, the experiential therapy we talked about, where he believed that through experiential learning, individuals constructed their understanding of the world based on their direct and their personal experiences. John Bowlby, who is the father of the attachment theory, he believed that there was an emotional bond in relationships that was, as he said, a lasting psychological connectedness between human beings. He also believed that one's development was strongly impacted in early childhood experiences, especially those of emotional bonds that were created with loved ones. The third person she credits is Salvador Minuchin and his structural theories. In this, he believed that behaviors and relationship interactions affect and elicit a response from those in the relationship. An example I found of this on mywellbeing.com would look like, I withdraw because you nag, and you nag because I withdraw. So how is EFT treatment supposed to work? Well, emotions are the organizing principles of our lives. Our emotions are the underlying reasons for all of our behaviors. EFT can help us understand those negative patterns and how they're related to the underlying attachment-related fears that we have inside us. It could turn our emotional weaknesses into vulnerabilities, and it helps us develop the emotional intelligence and awareness. So, in a nutshell, it's trying to turn these emotional misunderstandings from weaknesses that are causing issues in our lives into vulnerabilities that we can open up and share with others to help us build a stronger bond in relationship with that person we're sharing it with. EFT was designed to help individuals, couples, and families. The main emphasis so far has been on couples. It's been expanding further into families and individuals more recently. Emotionally focused therapy isn't the most creative with their acronyms, but it kind of helps in that it's very straight to the point. The core emotionally focused therapy is just called EFT, and then they just use a letter indicator to indicate who they're going to be using EFT with. So couples would be EFCT, family would be EFFT, and individuals would be EFIT. Some of the main things that emotionally focused therapy is intended for is addiction, depression, emotional dysregulation, post-traumatic stress disorder, relationship issues, conduct disorders, trauma, and really anytime a relationship is in need of a more secure bond. Within these issues, EFT aims to address different things such as creating an awareness to the emotional experiences and patterns that you may be exhibiting, decreases your emotional reactivity. It can help you develop or restore a bond or a sense of security with somebody else, and it helps to recognize your own attachment-related emotional needs. What is the EFT process? Well, it's a therapeutic-based setting using various techniques based on the needs of the client and the individuals that are in the sessions. It's 8 to 20 sessions, typically once a week, and through it, the client will go through 9 total steps that's broken down in 3 different stages. The therapist will help the individual or individuals recognize if they are pursuers or withdrawers, and the therapist's role is to keep the clients on track while they progress through the steps and stages so that they don't get sidetracked and go off course. So here's a picture that I found that outlines the EFT therapy process beautifully. The 3 stages and 9 steps are listed on here, with stage 1 being the de-escalation of negative cycles. Within stage 1 are the first 4 steps. Step 1, to create an alliance and identify the attachment struggle. Step 2, to identify the negative cycle. Step 3, to access the unacknowledged emotions and positions. Step 4, to reframe the problem in terms of attachment and negative cycle. After this, they move on to stage 2, which is to change the interactional patterns and create engagement. In here we have step number 5, to promote identification of disowned attachment needs. Step number 6, to promote acceptance of partner's experience. And step number 7, to direct expression of needs while strengthening attachment. Underneath step 7, you'll see a little note that says start with withdrawal, then move to the pursuer. We'll get more into the withdrawers and pursuers in a little bit here. The final stage is stage 3, which is consolidation and integration. Step number 8 is to facilitate new solutions to old problems, and step number 9 is to consolidate new positions and attachment. Again, there's a note at the bottom of this that says steps are not perfectly linear. Most clients move back and forth. Here's a list of the EFT therapeutic tasks and techniques that are used. Empathy-based techniques are the first one. This is exploring problems with clients using empathy to help identify the vulnerabilities that they may have in order to help lead them towards self-affirmation. The next is relational methods, which help build a strong therapeutic relationship and a safe atmosphere to create self-awareness and connections with the therapist and those that they may be in the EFT with. Next, we have practicing methods. This is you need to make time and the space to help focus or help the client focus on what they are feeling while teaching them the appropriate expressions of those emotions. Next is action tasks. A couple ways this could look is chair work or enactment to help address some feelings that the client needs to get out. The chair could be an empty chair where a client just turns to it and talks as if they are talking to a person to help them get out the feelings that are kind of bottled in. Next up, we have task reprocessing. This is usually going through traumatic events. They can work with a therapist to help them process or reprocess these past events to help the healing. And finally, we have EFT tapping, which is kind of annoying because they use the same acronym EFT, yet it stands for Emotional Freedom Technique. This is kind of newer, and it's something that can be added, tapping on the body that can be added to those who are in more need when they are reprocessing some traumatic events or they're struggling with some strong emotions. I'd mentioned the pursuer or withdrawer a little bit ago. Now I'm going to dive a little bit deeper into it, and after I explain each of them, I'll go deeper into what they each mean and how they work together. First off, we have the pursuer. So what this could look like to others on the outside is they're complaining about things more than their partner. They're always trying to explain themselves. They push or they'll demand answers, and they disconnect from their the disconnect from their partner feels unbearable to them. On the inside, they may feel like they're the only ones doing most of the work. They hope that their partner will connect with them in time, and they believe that the only way to resolve issues in a relationship is to talk. A lot of times they're feeling alone and they just want a far more emotional connection with those around them. And the frustration and the demanding that you might see could actually be to just mask the fact that they're scared and they're vulnerable. Withdrawers, on the other hand, may present that they're very dismissive of things, that they need the space to cool down or think things over. They might fight, but when they fight, it's not necessarily because they want to argue, but it's to push away to get that solitude that they're looking for. And then they might try to numb their negative feelings in different ways. On the inside, however, a withdrawer often feels like their partner is very dismissing or minimizing of their everything, basically. They don't like to start a fight or argue, but when they do, sometimes they can just explode. They believe that authenticity is far more important than giving the correct or the right answer in situations, and they may look stoic. You can't get a good read on them. They hide it very well, but they're very sensitive, or I should say they're just as sensitive as their pursuer partners. One of their biggest fears could be that they are a disappointment in their partner's eyes. Now that we have the generalized descriptions and you kind of know what they are a little bit better, it can be known that you can be both, but most people are predominantly one or the other. And this is typically shown when it's times of bigger conflict, which way the person goes. It's not just sometimes you do this, sometimes you do that. It's in bigger terms, bigger times of conflict, what do you do? And that's when this is looked at. This is based largely off of John Bowlby and Mary Ainsworth 3 attachment styles that most people know. Instead of the pursuer withdrawer, it's the anxious, avoidant, and disorganized. Anxious being the pursuer, avoidant being the withdrawer, and disorganized being a rapid switching between the two, which isn't super common. It is important during the EFT therapeutic process to know if you're a pursuer, if you're a withdrawer, and what your partner is, because this will help us to identify what our values are, what their values are, and what positions they'll take when conflict does present itself. So I dove deeper into 6 different articles to look and analyze them a little bit more to see the outcomes and the quality of the research behind EFT. This was in order to try to gather more information to try to see if I believe that EFT is a process and if it's worth pursuing in the future, or if it's something that's just kind of, maybe we should kind of focus somewhere else. A lot of these offered a lot of similar things, but I tried to focus on stuff that was different methodologies and that had different outcomes to try to make sure I was grasping everything with it and not just focusing on one thing or another when it comes to EFT. The final article, Article 6, is actually more of a clinician, what clients are looking for in the EFT sessions from the EFT therapist. It's not so much of an analysis or a meta-analysis as the others are. The first article I went into was a comprehensive meta-analysis on the efficacy of emotionally focused therapy. They conducted a larger scale meta-analysis on EFT than had previously been done by anyone, using a randomized control trial, quasi-experimental, and dissertation studies. There was a total of 20 studies looked at and 332 couples, so they had a big group and a lot of numbers to look at here. They ended up measuring 3 different ways, looking at pre-test versus post-test, EFT versus alternatives, and then the pre-test follow-up. All 3 of these ways did produce positive and statistically significant results showing that EFT is beneficial. When looking at the treatment outcomes, for positive outcomes, it showed that EFT did have positive effect in all the areas when they were compared to a viable alternative couples intervention. There were no negative results found. The relevance for this is that EFT efficacy was showed to have positive results in couples and family therapy. And the expert consensus regarding this effectiveness was that EFT was effective and successfully treated 70% of all the couples that were put through the process. The quality assessment of the research showed that they had methodological, I can't say that word, so from here on out, I'm just going to say method strengths, or sensitivity analysis that was implemented to cross-check the areas that may be a threat to their validity. Some weaknesses in the methods were that they had a modest sample size of 20 studies and a mean of 14.3 couples, which produced a few statistically significant moderators of the EFT effects, and the potential for publication bias was that